feeling. That is maybe one thing. One more thing I want to tell is, as you told that the results are fabricated. Sometimes they are telling, sir, could it cover the serotypes, different serotypes? Could it be cover the O type, N type? These are all not common in our country. They are seeing all the Google opathy and then they coming and asking. So thank you, sir. Thank you. Sorry for this.
Thank you, sir. So I take that opinion again, or that comment again, in a very positive way, in the sense that, yes, most of the times when patients come to you, it's not only in your practice, I think it's a universal phenomenon. I have heard it from my colleagues even in abroad, that when a psychiatric reference is given, it's always why. This is not psychiatric. But I think if we learn to stand, like again yesterday Rupin Shah sir was saying that we don't let the patients dictate. We have our clarity, ki, no, this is what I feel is here, please go. And I believe that most of the psychiatrists are very well versed. They will listen patiently, they will hear, and they will always make an effort to educate the patient, what we call as insight therapy. We will be doing that. Yes, some of us may be taking it lightly, that's a bad part, but I don't think all of us do it.
Venorophobia, though it looks to be a venorophobia, but I think somehow it's a misconception, misnomer. It's actually not phobia, where the person doesn't avoid in going and having sex. It starts after having sex, where he starts thinking that he now has got some other venereal disease. He keeps on demanding about investigation, he keeps on demanding some medication for his venereal disease. So though he has listed all these diseases which can be classified under DSM, but more or less it's illness anxiety, either illness anxiety or obsessive compulsive disorder. Very less time it turns up to be phobia. It's more or less obsessive or illness anxiety.
Illness anxiety. Agreed. But then that is for you and me as psychiatrists. But for the others who are non-psychiatrists, I think we need to make them aware of the multiple dimensions that we'll be taking them through.
Dr. Khetarpal from SR. I think if the treating doctor convinces the patient that this symptom that is distressing you, this fear, and this fear needs to be subdivided, why it is so, only a psychiatrist can go into depth, and then subtypes of this fear like OCD, delusional disorder, then he can give a better drug to soothe you. You will get better results from psychiatrist, and if you convince the patient, he will definitely go to a psychiatrist.
Definitely, sir. Yes. So, till you asked the question, just before I came here on Friday morning, Thursday night I had a call from, so I work in one of the hospitals in Pune, and over a period of the last 10 years, I have managed to develop a good rapport with the people who work in my hospital, right from the gastroenterologist to the hepatologist to the urologist, and we have a good liaising level now. So I received a call and I went to see the patient at around 10 p.m. in the night. And as I was talking to her, she figured out I am a psychiatrist. So usually the way I go about is I understand this fear that psychiatrist ke paas kyun bhej rahe hain mujhe. So I take the history, I go down, and then at the end of everything I tell them, by the way, I am Dr. Ninad Baste, I forgot to introduce, I am a psychiatrist. And then by the time they get to know me for those 15-20 minutes, they are more open up. They have discussed everything, and then they are अच्छा ठीक है. Then वो उनके मन में से भी चला जाता है पागल का डॉक्टर नहीं है, यही एक डॉक्टर है जो मुझे समझता है. So when I was taking the history, midway she picked up, are you a psychiatrist? I told her, yes, I'm a psychiatrist, I'm Dr. Ninad. I forgot to introduce it. And she said, oh, your name has been told to me in the last 1 month by 3 different doctors, but I am so afraid of coming to you, but now I am relieved finally you are here. So I think it's their barrier also, and as doctors, if we can reduce that barrier, ki no, I assure you, because primarily, see, it's a person, they have come to you with trust on you. So if you can put that trust, ki no, you go, I will be there, they will definitely come.
Yeah. What I happen to do as dermatologist and with whatever small knowledge as regards psychology, well, I use something called as a Nathaniel Branden technique. You must be knowing, who was a student and an ex-lover of Ayn Rand. And really it works very powerful, something called as a phobia ke piche phobia. So the dialogue goes something like that. See, I am asking the question. Ultimately, everything lies in the meaning that is there in the patient's mind. So I ask him, okay, तो आपको हो गया, मैंने वेनोरोफोबिया है, डायग्नोसिस किया, हो गया, तो फिर क्या? तो फिर मैं सेक्स नहीं कर सकूंगा. And if you, then I ask, if you don't do sex, then my wife will have a doubt. And if your wife would have a doubt, then again I will not do the sex. And if that continues, then she will investigate me. And then what? And then I have to tell the truth. And then if you tell the truth that you have gone, then what? Then she will divorce me. And if she divorces you, then what will happen, sir? Then my children would be really traumatized. And if you are traumatized, then I will be a very poor father. Oh. So behind that वेनोरोफोबिया, उसका मतलब है उसके बच्चे का क्या होगा. So fabric का thread कहाँ जा रहा है. So and that really works very powerfully. And as Nathaniel Branden has said, that the patient knows more than what he knows that he knows. And another track will go, and okay, then there's a second patient with the same venerophobia would say, okay, when either I ask him to write, and or there is a dialogue. Okay, so अगर हो गया आपको तो STD हो गया तो फिर मैं सेक्स नहीं कर सकूंगा, और अगर सेक्स नहीं किया तो नहीं, फिर मेरा इरेक्शन नहीं होगा, और इरेक्शन नहीं हुआ तो फिर मेरा पुरुषार्थ चला गया. So we have to, behind that phobia, what is the meaning that is there in his. So if we go, and I would request all of you, I don't know how many of you do, but we can always meet and you can apply this technique, and it's a well-recognized technique, Nathaniel Branden sentence completion technique, where I think it works in a very fast way, something like a Freudian, anti-Freudian, and neo-Freudian or anti-Freudian, because we do not have time, okay? So that is the contribution as a dermatologist I wanted to give.
Prasanna.
Yeah.
No, that's what I'm trying to tell him. Prasanna, this is, you have simplified it, but this is a very wrong way to do. Okay,
yeah,
this will, let me finish.
I would require feedback from you. Yeah, sure.
This is a very wrong way to do, because you don't know on whom you are doing this.
Yeah.
You know, counseling, like, again, this comes from the heart. This word has been abused and abused and abused. Everybody thinks I'm doing counseling. I'll tell you why. Okay, if you read on one of the reviews, I recently got a client about 2 months ago. His father had committed suicide, and he went to a so-called counselor in Pune. And the counselor, while listening to him, told him, ki, boss, your father did something which required a lot of guts. And this person started thinking, am I bad? Don't I have guts? And he started having suicidal ideas. You have induced that. Okay, sentence completion test can be used just to identify the fears, but it cannot be used as a means of therapy.
Yeah, that
you
I
can
fully
get
agree.
to that.
Yes.
Okay,
after
let me
I
finish.
get it, yeah, sure.
Okay.
Yeah.
So, sentence completion test is used, but it is never as a therapeutic mode. It is just to get to that. But beyond that, once you have landed up there, you should know at the end of the day, what is the disorder? Is there any disorder?
True.
Am I missing out any disorder? And only if you are absolutely sure, boss, yahan pe koi disorder. Now this person, he has a multi-crore company. Never before had he visited a psychiatrist. But this one sentence, it triggered off that OCPD in him. He started having that thought. Finally, when we sat down, he came in with his wife, who herself was a doctor. They were referred to be by a physician who assured them, ki, no, you go and see what happens. We treated his anxiety first, then we began to talk. Then this came out, ki, this what psychologists told me, then, you know, am I this bad person or am I weak? And it was the guilt that, you know, he couldn't pick up the loneliness in his father, who finally did this. Then it all finally unraveled. But the point here is one wrong message at a wrong point in time, before you have understood the things in totality, it may wreck things.
Yeah. No. I am not saying that I will be treating him I will rather take that, and I will definitely refer the patient to you only, psychiatrist. क्योंकि मेरे को मेरी मर्यादा मालूम होनी चाहिए ना. So, no, not counseling. This is just
This
something
word
like a
has been-
catharsis. Yes. Sure. Just a single, since we are over here, and definitely I am not claiming that I am doing that. I just, rather I am asking your feedback, and I might go wrong, surely. Correct me if I am wrong. Yeah, just a second. So the thing is that one case was there, and non-consummation of marriage. After digging him for 45 minutes, 3 sessions, he said that, अरे मेरे को ऐसा लगता है कि जब भी मैं सेक्स कर रहा हूं तो उधर एक कोने में से देयर इज अ छुपा हुआ कैमरा जो हमको शूट कर रहा है. तो मेरे को समझ में आया कि अरे मेरा काम ही नहीं है, ये मेरी मर्यादा है. इमीडिएटली आई रिफर्ड दैट पेशेंट बिकॉज ही हैड दोस डिल्यूजनल आइडियाज टू अ साइकियाट्रिस्ट ओनली. सो व्हाट आई वांट टू से दैट आई एम नॉट क्लेमिंग दैट आई एम काउंसलिंग. या sure but thanks for that.
I invite Dr. Dureswamy to felicitate Dr. Baste sir.